Hello everyone, my greetings to all the members present here, and today I, Saya, would be presenting my report on the assessment of the dynamics of clinical and radiological signs in patients with severe atypical pneumonia due to the etiology of COVID-19 on the background of chronic obstructive pulmonary disease. So my friends, was this so prevalent that we had to conduct a study? Yes, of course. We all know that there was a global increase in the cases of COVID-19 and the deaths were also rapidly increasing. So it becomes relevant for us to study. Here I have depicted in the map that various countries that were affected by COVID-19, the darker shows the number of cases were high, the lighter the number of cases were low. By this we can understand that how important it is for us to conduct this study because there was so much increase in the cases of COVID-19. Now the relevance becomes because we know that viruses can trigger acute exacerbations of the idiopathic pulmonary fibrosis and progressive fibrosis. Risk factors for both COVID-19 and IPF include, what are the risk factors that they include? They are increasing age, male sex, comorbidities, smoking, and genetic polymorphism. Bilateral pneumonia is also a complication due to COVID-19 and it can get more severe on the background of COPD. In this type of pneumonia, we know that both of the lungs are affected. The tissue around the air sac that we call the interstitial tissue gets irritated and filled up with the pus and can lead to fibrosis. We all are aware that COVID-19 disease is a dangerous disease due to its severity and its complications as compared to the other viral diseases. In most patients, the development of severe atypical pneumonia against the background of COPD disease was complicated and it resulted in the death of the patient. Thanks to this, it differs from other pneumonia and is relevant for all of us. We all know that X-ray examinations are important diagnostic tool in any field of medicine. And specifically for this, it helps us to assess, to determine the affected area, the volume, and also gives us an idea for the prognosis of the disease. The objective is to evaluate the dynamics of clinical and radiological changes in patients with atypical pneumonia of COVID-19 etiology against the background of COPD. The research material and method that were used to conduct these studies, a total number of 43 patients were observed, among which 28 were males and the 15 were females. The average comes out to be 65.11% were the males and 34.88% were the females. The age of the patient varied from 21 to 65 years of age. The mean average that we take out comes out to be 43.3 years. Anamnesis that was collected was about 1.5 years. That comes out to be plus minus 0.45 years for each patient. They all were diagnosed with bilateral atypical interstitial pneumonia on the background of COPD and they were treated as inpatient and outpatient at a city medical facility. When we are making the diagnosis for these patients, their complaints, their medical history, hereditary and the course of action, they all were taken into account and all patients were diagnosed with broncho-obstructive symptoms and a negative bronchodilator test. The clinical symptoms and the chest radiography using MRI, MSCT were studied according to the severity of the disease. The severity of the main clinical symptoms like shortness of breath, cough, sputum and the weakness, all of them were assessed using a scoring scale from 0 to 3 points and using CT indicators scores from CT0 till CT4. The shortness of breath, there were 0 points were given that if that does not bother the patient, 1 point with significant physical activity, 2 points when a patient did a minor physical activity, there was shortness of breath, and 3 points were given when a patient suffered from shortness of breath at rest. Now, the cough, 0 point was given that it does not bother the patient, it is not severe. 1 point was given for rare episodes during the day. 2 points were given for rapid, again, like continuous episodes during the day. And 3 points were given for the almost continuous coughing to the patient. If we talk about the sputum, 0 point was given if there was no sputum. 1 point was given if there was a minor production of the sputum, mucus was present. 2 points were given if the mucus it was purulent and mucus. And 3 points were given if the mucus was purulent. Weakness, it was assessed on 3 points. 0 point, it was like not bothersome. It does not affect the patient's daily life. There's no problem. 1 point was given if there is slight weakness, even after doing some little physical activity, and the 2 points were given severe, like the patient felt weakness, he or she could not do anything. To evaluate the CT indicators, we gave the score from 0 to 4 points. CT 0 was given for the no lung damage, CT 1 for lung damage which was less than 25%, CT 2 was given to the patients whose lung damage was about 25 to 50% of the lung volume was affected, CT 3 for patients whose lung volume was affected more than 50 to 75%, and CT 4, the most severe one, it was given to the patient whose lung volume was affected more than 75%. Based on all the indicators that I told you before, the severity of the disease in the patient was determined, and the fibrous process of the lung was studied with the help of the radiological signs. If we talk about the results that we got from this study, there were CT2 patients, there were about 25 to 50% was affected in 13 patients. CT3, that is about 50 to 75% of lung volume was affected in 18 patients. CT4, 75% of the lung volume was affected in our 12 patients. If we try to understand the result now, I told you the CT2, we observed 13 patients in which 25 to 50% of the lung volume was damaged. Now on CT3, there were 18 patients in which 50 to 75% of the lung volume was damaged. They had severe COPD but stage 3. In the X-rays of these patients, we saw thickening of the interstitial tissue, fibrous shadow. They were of various shapes, various sizes. They were non-linear, indistinct, and dull consolidations were observed. On CT4, 75% of the lung volume was affected, and it was observed in 12 patients. They had severe COPD, categorized as stage 4. Fibrous foci appeared in the affected area with the sign of dark mirror, with a shady look like a beehive. So if you guys look in this picture, we try, what is a honeycomb? Honeycomb, beehive, this from which we get the honey, the house of the honeybee. This resembles this. The X-ray of these patients, the affected area of these patients resembles the honeycomb, so we call it beehive sign. Now to conclude and summarize, we know that the more the clinical symptoms, the higher the points of the clinical symptoms, the more will be the radiological signs, and that means the more will be the affected area and the more severity would be there in the patient. So according to the results of the X-ray examination in the patients with COPD and severe pneumonia, we saw fibrous foci in the subpleural areas, which gave the image of the dark mirror in the form of they were uneven, pale, linear, shadows with fibrous, and very small foci were seen in the affected area. I showed you the X-ray. This condition indicated, what did it indicated? The thickening of the interstitial tissue of the lungs and the formation of pulmonary fibrosis. Why? Because of the interstitial inflammation. So as a result, it leads to development of early pneumosclerosis. If a patient does not continue the therapeutic measures to stop the fibrous process, it is possible that the prognosis would be bad. It can lead to the aggravation of the process, development of the respiratory failure. We can have pulmonary heart failure and various other complications. So it is very important for these patients to have the therapeutic compliance. So that's all from my side, guys. Thank you so much for paying attention.